next assessment I'll be performing is the neurologic assessment. In this assessment, we'll be assessing the 12 cranial nerves and the deep tendon reflexes. We'll start with the 12 cranial nerves. I'm going to go ahead and start with the olfactory nerves. What I'm going to do, that's cranial nerve 1, by the way. What I'm going to do is ask the patient to close one nostril and smell, and we'll repeat on both sides. Would you please cover one? And the other side? And what do you smell? Lavender. Very good. Next, I'll be assessing cranial nerve number 2, which is the optic nerve. I'm going to ask the patient to cover one of her eyes, and I'm going to move my finger into her field of vision, and she'll let me know once she can see it with her peripheral vision. Would you please cover one of your eyes? And let me know when you see my finger. Now. Would you please do that for the other eye for me? You let me know when you see my finger. Now. Very good. Next, we'll be assessing nerves 3, 4, and 6, 3 being the oculomotor, 4 being the trochlear, and 6 being the abducens. We'll first assess the oculomotor by looking at Perla. I did this previously, but we're going to look at it again. Normally, I would have a pin light, and I would be assessing to make sure her pupils are equal, round, reactive to light, and about what size they are. So we're going to go ahead and pretend I have my pen light, and we will shine into the eye. Pupils are equal, round, reactive, and have good light reflex. Next, we'll be assessing the accommodation. We'll do the finger test. What I'm going to do is ask the patient to look past me, and I will move my finger into her field of vision. What we're doing here is to assess to make sure her pupils are constricting and dilating as they are supposed to. So if you'll please look past me, I'm going to move my finger directly towards your eyes and then focus on them for me. Good job. Pupils were good at dilating and constricting. And lastly, we're going to do the cardinal eye movement. And what we're going to do here is we're going to move the finger to 5 points and have her eyes follow my finger. This is a way to assess for lid lag, nystagmus, etc. So, if you look directly at me, but use your eyes to follow my finger. 3, 4, and 6 were intact. The next cranial nerve we'll be assessing is the trigeminal. What I will do is ask the patient to close her eyes and let me know when she feels the touch on her face. Ooh, please close your eyes and let me know when you feel my touch. Now. 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 You may open your eyes. Next, we're going to do the facial test of cranial nerve number 7, which is the facial. What I will do is ask the patient to do several things with her face, such as raise her eyebrows, smile, etc. So, if you will raise your eyebrows for me, and drop them, and big smile, frown. Good job. We'll be doing the whisper test. What I'm going to do, normally I would do this bilaterally, but I'll ask the patient to cover her ear, and I will whisper something about an arm's length back from the patient, and I'll have her repeat it to me. We're going to just do it on the patient's right side for today. So if you would please cover your left ear for me. I'm going to just ensure, I'm going to whisper something, I want you to repeat to me what it is. 3, 4, 6. Very good. Next, we'll be assessing cranial nerves 9 and 10, the glossopharyngeal and the vagus. For the glossopharyngeal, I've heard the patient speak throughout our several videos, and I can tell she has a smooth voice, which is ideally what we're looking for. And then with the vagus, I'm going to stick what I normally would be a tongue depressor. We won't today. I'll have the patient open their mouth and say ah. So I'm looking for the uvula to move up as she says ah. You could open your mouth and say ah. Ah. One more time. Ah. Perfect. Both are intact. Next, we'll go ahead and do the spinal accessory, which is cranial nerve number 11. I'm going to ask the patient to shrug her shoulders and make sure we have symmetrical movement and strength. You could shrug your shoulders. Good job. Lastly, we're going to look at the hypoglossal. This is cranial nerve number 12, and I'm going to just ask the patient to stick her tongue out, and we're going to look for any deviation or irregularities. Thank you. Next, we're going to go ahead and do the deep tendon reflexes. Normally we would have the triangle percussion, but we do not have that today, so we will be demonstrating with this. So, Normally I would do this bilaterally. Today we're just going to go ahead and do it on her right side. Okay, so first I'm going to do her brachioradialis. I'm going to ask the patient to please relax her wrist, and I'm going to tap, and normally we would see a nice jump here, almost in the thumb region. Next, we're going to move to her bicep. I'm going to ask the patient to relax her arm on mine, and I will go ahead and hit here, and normally we would see a nice response in this arm from that. After that, we're going to go ahead and move to the tricep. I'm going to ask the patient to relax her arm again. We're looking for a nice jump from the arm like this. We probably won't see it because we don't have the correct tool, but we're going to go ahead and hit, and we would see that little movement there. After that, we'll go ahead and move down to her patellar. This is the one you typically see in TV shows and stuff, but we will move, we will feel for that quad down to the lower leg and hit, and we expect to see a normal jump kind of like that. Lastly, we're going to be assessing the Achilles reflex. So we will hold the plantar portion of the foot, and we're going to hit back where the Achilles is. What you're expecting is to feel a constriction in this plantar region. So, and I would feel a constriction there. This concludes the neurological assessment.